And thanks for staying with us. Millions of Americans are living with type 2 diabetes, the most common form of diabetes. And there are a lot of people out there who don't know they're at high risk for developing this disease. Joining us today is Melissa Gerlach from Mercy's Joslin Diabetes Center. Thanks for coming in today.
Thanks for having me.
So there are two types of diabetes, type 1, type 2. Correct. What's the difference between the two?
Type 1 was primarily diagnosed in children, or what we used to think diagnosed in children. Basically, the difference is type 1, the body stops producing insulin, and those patients need insulin right away. Type 2 is more of an acquired condition. We think being overweight, lack of exercise leads to that condition, and those patients have a few more options to treatment.
What's the trend? Are we seeing more people now being diagnosed with type 2 as time goes on?
Unfortunately, we are, and just with the obesity epidemic, we're seeing more and more children being diagnosed at a younger age with type 2. You can be diagnosed with type 1 or type 2 at any age. Unfortunately, we're seeing type 2 more and more at a younger age.
So this is certainly something that we want to be talking about. So
absolutely. Just
kind of walk us through, you mentioned, the obesity epidemic. What are some of the risk factors for type 2? Risk
factors for type 2, if you've ever had gestational diabetes or been told that you had problems with blood sugar during pregnancy, again, being overweight. If you're not getting a lot of exercise, we recommend 30 minutes of exercise every day. If you're not eating healthy foods, if your diet is rich in maybe chips, cookies, those types of things. Certain ethnic or racial groups are more prone to the development of type 2 diabetes. Those are some of the big risk factors that we encourage patients to talk with their physicians or providers about getting screened for.
And you mentioned diet, so let's talk a little bit more about that and some of the dietary advice that you might have for people who might be at risk for type 2.
Sure. Some of the best advice that I think we could all benefit from are smaller portions. Just cutting your portion sizes down every day, eating more fresh fruits and vegetables. Diets that are higher in fiber and lower in fat are also going to be better for patients, whether they have diabetes or not, but it's going to be ideal for patients with diabetes.
Something to keep you out of that risk factor if you're even on the verge.
Exactly.
And if people are at risk and they want to find out more information or perhaps want to have a test done to find out where they stand, how can they do that?
Sure. I would encourage them to talk with their physician if they have any risk factors or family history, or if they're just concerned, having that open communication with their provider. And then at the Joslin Diabetes Center, we'll be there to provide the support and education after they've had that conversation with their provider.
It can be confusing at first, and you have to figure out levels and everything like that. So
exactly.
All that advice is very helpful. Well, Melissa, thank you so much for coming in today. We appreciate it.
Thank you for having me.